leave no medic behind, supporting medical students in need. Dr. Oswere is committed to advancing healthcare through education, advocacy, and collaborative leadership. Yeah, so our interpreter will be teacher editor. So she's a professional Kenya Sign Language trainer. Yeah, and she will be our first interpreter today. So I'm hereby welcoming the two of them, and we can now start our session. So welcome and feel free. If you have any question, please just type on the chat box. Yeah, and we will read and interpret. Thank you. So, Dr. Ruby, I think the floor is yours. Welcome.
Thank you. Thank you so much. I can just put on my video for a few seconds and wave. Hi, everyone. Nice to see you. My name is Dr. Ruby. Thank you so much, Doreen, for the introduction, and a special thanks to the Deaf Health team for inviting me for this very insightful session. I'm very humbled and glad to be able to discuss this important topic with all of you, and I hope we will be able to learn together. So I've just projected my screen. I trust it is visible. Maybe Doreen, you can just confirm. Is it visible?
Yes, it is visible. It is visible.
All right, fantastic. So, karibuni tena to today's session. We are going to be talking about diabetes. So we are going to be breaking down some of the main aspects of this disease. And so I listed down some of the learning objectives. Maybe I can just rush through them. So we're going to define what diabetes is, and we're going to explain how it affects the body. We're going to differentiate the main types of diabetes, so type 1, type 2, and gestational. We're going to be able to recognize some of the common signs and symptoms. We're going to understand the causes and risk factors. We'll identify complications, and what a complication is just a situation whereby the disease gets worse or it affects other parts of your body as a result of it not being managed correctly or treated correctly. That's what we call a complication, right? Then we're going to learn about how diabetes can be diagnosed through some blood tests, and we'll explore ways to manage it as well as prevention. So that's a brief summary of what we're going to cover today. Don't worry if you don't have a background in healthcare or medicine. Everything has been broken down in a very systematic way. And feel free to put in your questions in the chat box as we go along, and I'll be able to address them at the tail end. So we'll take maybe about 30 to 40 minutes on my presentation. Then we will leave some space for questions, right? Okay, karibuni sana. All right, so we begin with a definition. What is diabetes? So in simple terms, diabetes is a condition whereby the sugar level in the blood becomes too high, right? And this happens because the body has a problem using a particular hormone called insulin. So insulin, it's a hormone that allows glucose to enter the body cells from the bloodstream. So my presentation, especially in the first half, I have a lot of nice little diagrams here to help us explain. I really enjoy teaching with diagrams, you know. And so let me just confirm that my pointer is moving around on the screen. Can you see a little red pointer moving around? Maybe Doreen or Ronaldo confirm. Yeah.
Yes, we can see the pointer.
You can see the pointer. Fantastic. Right. So this is just a quick picture summary of what we see in diabetes. So glucose is a molecule that comes from the food that we eat. So if we just start with the basics, you know, to remind ourselves a bit of science, right? So when you eat food, right, that food is digested, and it's converted to the simplest molecules, right? And when you're thinking of, for example, carbohydrates, the simplest molecule would be glucose. So once you've eaten your ugali, your lunch, dinner, breakfast, and it is broken down to glucose, right? This glucose is found in the blood. Why is it found in the blood? Because when it's digested in your stomach, it goes to your intestines and then it's absorbed into the bloodstream. You understand? So this is blood that contains glucose. But remember, this glucose needs to go from the bloodstream into the surrounding cells, right? Because within the bloodstream, it's like an enclosed pipe, right? So you need some special mechanisms to allow this glucose to, permeate or pass through and enter the cells. So when you have a condition whereby the sugar level in the blood becomes too high, then we can see that that could be caused by a situation whereby the glucose is not being transported correctly into the cells. So sometimes we usually say diabetes is a disease whereby you have starvation among plenty. Why is that? It's because you have enough glucose in the blood. In fact, you have enough glucose in the blood, correct? In fact, you have too much glucose in the blood, but the cells are still starving because they don't have access. Think about it like a situation whereby, you're so hungry and there's food inside the house, but you don't have the key, right? So it is starvation among plenty, right? So let's move on to the next slide and see how insulin is meant to work in an ideal situation or in someone who is not diabetic. So in this next diagram, we're going to start here. So wherever you see these little green shapes, that is representing glucose, right? So glucose is in the blood. What else is in your blood? You have insulin. Now, this is the body cells. Here is the body cells. So we can see that, you can have the muscle or adipose tissue, right? And so when you have insulin, it binds to what we call an insulin receptor, right? Now, once it binds to this insulin receptor, it will affect a certain substance or structure within the cell called a glucose transporter, as you can see here. So once insulin binds to the insulin receptor, it now causes this glucose transporter to move towards the cell membrane. Can you see this as the cell membrane? So previously the glucose transporter was inside the cell, so it's now moving towards the membrane. And when it moves towards the membrane, what happens? It now creates these very nice channels through which now our glucose can move inside the cell. So sometimes people refer to this as a lock and key phenomenon, right? So it's like insulin is the key, right? That is opening up the cell for it to receive glucose, right? And this is just a series of pictures that's showing that process, right? So in a normal setting, in a patient who does not have diabetes, this is how the process should run. But now you can have a situation where things don't go according to plan. So we're going to look at the types of diabetes and explain how they come about. So we have two main types of diabetes and a few other types. So when we begin with type 1 diabetes, this is a situation whereby the body does not make insulin at all. So now the key that we need to open the cell is not being manufactured. You can also have type 2, whereby the body makes insulin, yes, but it does not use it properly. Or what we will see shortly, there's a resistance to the tissues, right? So the key is there, right? But there's a way in which maybe the lock has a problem or it's not fitting correctly. So insulin is present, it's being produced, but the way the body is interacting with it, causes an issue. And again, you'd have the same problem. You can also have gestational diabetes. This one will primarily happen during pregnancy, especially in the 3rd trimester or the last 3 months of pregnancy. That's now the last trimester. And you'd find that it tends to have features that look a bit similar to type 2. So let's look at some of the main differences between these two types. So with type 1 diabetes, as we can see, the body doesn't make enough insulin. But in type 2, the body is not responding to the insulin. In type 1, it's caused by an immune system reaction, and we'll see what that means in a minute. But type 2 is caused by lifestyle factors, and genetics can also contribute. Type 1 often starts in childhood, right? So if you find someone who is maybe below the age of 12, 10, having symptoms of diabetes, chances are high this is going to be a type 1. But now type 2 is more common in the middle-aged population, and we'll see how that ties in, especially with some of the lifestyle factors. Type 1 diabetes, symptoms will often come on very quickly, but with type 2, symptoms will develop slowly. Type 1 is primarily managed with insulin injections. Then type 2 can be managed with other drugs and lifestyle changes, but also insulin can play a role. So back to some more pictures. As you can see, I really like training with pictures. I think it helps things to become a bit clearer, right? So let's look at these illustrations that will show us now the difference in how type 1, type 2, as well as gestational diabetes and other, smaller subtypes can come about. So we start with type 1. We've said the body cannot make enough insulin. Why does that happen? Now, this is as a result of something called a hypersensitivity reaction. So without going too deep into the details, the main concept to understand here is you have an organ called the pancreas in your body, right? It's located somewhere in your abdomen that produces insulin, right? This is the pancreas. Now, when you have a disease whereby your immune cells in your body, right, the ones that are meant to fight, harmful bacteria, viruses, fungi, they're fighting intruders. But something happens such that they become hypersensitive and they start to attack your body's own cells, right? We see how that can be very problematic. So, again, without going too much into details, the main concept with type 1 is that your body becomes hypersensitive. And that means that there's an immune reaction that causes your body's T cells, which are a type of immune cells, to attack the pancreas. And that means that when the pancreatic cells are being attacked, they will not produce insulin. And so that explains our type 1. Great. Now, let's look at type 2. So in type 2, your body makes insulin, right? However, the cells do not respond to it, right? As you can see here on the slide, it's saying that the mechanism is not fully understood. So there are some aspects that we know. We know that patients with type 2 diabetes, they have enough insulin. Their pancreas is doing a good job. It's producing the insulin. Pancreas is fine. But the cells of the body, right, are not responding. So there's an insulin resistance. So research is still ongoing to get a better understanding of exactly what happens. But what we know for sure is there are some risk factors. What is a risk factor? A risk factor is a certain state of being, right, that causes one patient to be more likely to develop a disease compared to another patient, right? Now, let me explain what a risk factor is not. A risk factor is not a guarantee that you'll get that disease, right? That's important to notice. But it does increase your chances. So now some risk factors that have been well studied and linked to type 2 diabetes include obesity, lack of exercise, and hypertension. So again, what this means is patients who are obese or they don't exercise much or they are hypertensive, we see that they tend to have a higher chance of developing type 2 diabetes compared to those who do not have these risk factors. And just to emphasize one last time, this does not mean that, if you're not obese and you exercise and you're not hypertensive, that you can never develop diabetes. You still can, just that your chances are lower. Make sense? Great. Now, the last one is we have now other smaller subtypes. So we can see gestational diabetes, which happens in pregnant women, and they will have an increased blood glucose. We've seen what that looks like. And this usually happens in the third trimester or the last 3 months. The main cause that has been, studied and found to have some relationship here is hormones, right? So it seems that there's a way in which the hormones affect how the body is responding to insulin. And now that is what can be a bit of a problem. You can also have drug-induced diabetes, which can happen as a side effect of certain medications, right? So again, this mechanism is more related to the insulin resistance, which is type 2, and not autoimmune destruction or type 1. Nice. So what causes diabetes? I believe by now we already have a bit of an idea, right? Because it's taking us back to the risk factors. So number 1, being overweight or not exercising, eating too much sugar or unhealthy food, family history, that means if your parents have it or a close family member has it, right? And as well as getting older, right? Now, I put a statement here that, again, is very important for us to note. These risk factors are especially relevant in the case of type 2 diabetes. However, it is important to note that the presence of these risk factors does not mean that someone will automatically develop the disease, okay? Similarly, the absence of the risk factor does not mean that one can never acquire diabetes. So perhaps, especially if maybe you don't really have a background in medicine, you will hear a lot of talk about, risk factors or predisposing factors. So if you've ever been confused as to what that means, I hope this makes it clearer. We are playing a game of probability, So we're trying to see, right? What are the chances of person A getting diabetes compared to person B, right? But also, it does not mean that now we're saying it is a must that one person will get it as opposed to someone else. We always manage the patient in front of us. So by you trying to avoid these risk factors, they can help a lot, right? But also, there are no actual guarantees. I guess only God knows, how one's life will go and what your fate will look like, right? But these are some of the well-studied and well-documented risk factors. Okay, nice. Now, moving on. What are some signs and symptoms? This is really important, right? So first of all, sometimes patients will feel very thirsty, right? They might need to urinate often. Oftentimes, they can lose weight without trying. Let me explain this point a little bit, right? If you recall, in the beginning, we said one could define, and oftentimes diabetes is defined as a disease whereby you have starvation among plenty, such that you are eating, and sometimes eating a lot, because patients will often have, as you can see here, increased hunger. You're eating, but the glucose is not reaching your cells, It's like, can you imagine, someone is in the house constantly cooking food, but because you don't have a key to enter the house, you're just outside, You can smell the food, you can almost, taste it, but you can't access it, right? So oftentimes these patients will be very hungry. Actually, they'll be eating a lot, they'll be very thirsty, but they're still losing so much weight. So we have certain parameters now clinically to be able to tell how much weight the patient loses to cause us to, suspect diabetes. Also in the setting of other symptoms. So it's also important for you to know that don't just pick one symptom and say, hey, by the way, of late, I've been feeling thirsty. Am I diabetic? No. We need to look at it in light of the other symptoms, right? So feeling very thirsty, needing to urinate often, losing weight without trying, feeling tired or weak. And again, I think we can understand where this comes from because glucose is needed for your body to produce energy. So if your cells are not accessing that energy, then you're going to be very tired and very weak. And also you can have some blood vision, right? So just to recap, you can see here frequent urination, increased thirst, hunger, weakness, weight loss, blood vision, nausea, slow healing of cuts and bruises, and sometimes patients can also present with a tingling of hands, which can sometimes be as a result of a complication, and we'll look at some of those complications in a minute. And again, it's important for you to not just maybe pick out one symptom and say, I was feeling nausea yesterday. Does this mean I'm diabetic? So it needs to be a combination of these symptoms as opposed to maybe just one or two, right? Fantastic. Okay, moving on to now, how do you know for sure if you have diabetes? Let me start by saying you need to go to a hospital, right? You need to go to a hospital so that they can do some blood tests, right? So they are going to do a blood sugar test. So it's just a small finger prick. It's not very painful, very quick, right? Sometimes you can do a screening test at a clinic or a pharmacy. Sometimes they might refer you to a specialist. It just depends on how your symptoms present. So without going too much into the details, we have different types of tests that we do to be able to identify your blood sugar levels, right? So the first one is a fasting blood glucose. Fasting is, just the one that we know. When you're not eating, you're fasting, right? So you are told to not eat for about 8 to 12 hours before going in for the test. Then when you go in for the test, right? Depending on the levels that you have now, if it's greater than 126 milligrams per deciliter, this is now the diabetic spectrum. Then you can be pre-diabetic, then it can also be at a normal level. Now, if we recall in the initial slides, maybe just for us to remind ourselves, allow me to go all the way back, right? We were saying that when looking at the definition, you will have, right, a high level of glucose in the blood. So based on this concept, the main parameter that we're looking for is high glucose levels in the blood. So that's why you will be considered diabetic if the level of your blood glucose after you fasted. Notice the reason why you're fasting is so that we can at least get some baseline parameters and have a higher accuracy of the test, right? So if you're having 126 milligrams per deciliter or 7 millimoles per liter or higher on two separate tests, that's also important. It needs to be on more than one occasion. Then you do qualify, right, to fall within the range of diabetes. Now, there's another type of test that is done that's called an oral glucose tolerance test. Now, this is one whereby at the hospital, they will give you a glucose liquid to drink, So they'll give you some glucose like mixed with water, right? You're told to drink it. Then after 2 hours, we will measure your blood glucose. Now, this test is also very, very helpful. Why is that? Because we are trying to see, right? When we give you glucose directly, does the glucose remain in your bloodstream? And that means you will record still a very high level after 2 hours. Or is your insulin working well and your body is able to transfer this glucose into the cells? And that means that after 2 hours, when we test your blood glucose, it will be at a lower level or within the normal range. So I hope these tests are making sense even based on what we were explaining when it comes to how diabetes comes about. So with an oral glucose tolerance test, again, they will give you a sugary drink, something with glucose. Then after 2 hours, we check if the levels in your blood are still high. That tells us the key is not working. And what is the key? We said it's insulin, right? But now if after the 2 hours, at least the levels are a bit lower, then that means that insulin is working well and your body tissues are also responding well to the presence of insulin. Great. So this is just summarizing. So confirming the diagnosis of type 2. So fasting glucose, if it's 126 milligrams per deciliter or higher on 2 separate occasions, and with an OGTT test, which is now the oral glucose tolerance test, 2 hours post OGTT if your level is 200 milligrams per deciliter or higher. There's one more test called the HbA1c. Okay, maybe you don't need to know too many details about this, but it is measured in percentage, right? And so if the HbA1c is 6.5% or higher on 2 separate occasions, then again, we would be able to confirm a diagnosis of diabetes. So FBG is fasting blood glucose, HbA1c or OGTT that's high on 2 occasions or more. You can also do a random blood glucose. So a random blood glucose means, you're testing it randomly. We've not asked you to fast. We've not given you glucose liquid beforehand. It's just, someone who walks into a facility and we're just screening them. Then we can do a random blood sugar test, right? It might not be as accurate in terms of giving a fixed diagnosis. However, it does give us some indication, right, as to whether we need to investigate further or not. Great. So moving on to complications. And as I defined earlier, a complication is a situation whereby the disease gets worse when it's not treated or managed well. So what happens if diabetes is not treated? So diabetes is one of those conditions that has a way of affecting so many other organs, because at its foundation, it seems like a very small or simple problem, You have a lot of glucose in the blood, right? So how much harm can that cause? You would be surprised. It can do a lot of damage in all the organs. And how we differentiate, how we divide complications is we say you can have microvascular, which means the complications in the small vessels, and macrovascular, which means complications in the larger blood vessels. So what are some microvascular complications? You can have retinopathy. And a fun fact on this is that diabetes is actually the leading cause of reversible blindness here in Kenya, right? So it can lead to eye damage or retinopathy. It can damage the kidneys. This is a huge one. Nephropathy, you will find there are very many patients who have chronic kidney disease, and the real, culprit was diabetes that was not well managed or not well controlled. You can have neuropathy, which is now nerve damage, right? And the combination of neuropathy as well as poor circulation to the limbs can lead to what you might have heard of being a diabetic foot, right? Whereby sometimes patients can develop these very painful ulcers that are not healing. So you can see here, may cause foot wounds that don't heal. It's a very common, very, very stubborn complication of diabetes, whereby patients can get, long-standing ulcers that eventually can even lead to amputation of one's foot, right? And it's literally called a diabetic foot ulcer. Diabetes can also increase your risk of getting a heart attack, so that's cardiovascular disease, and also cerebrovascular disease, whereby it can increase your risk of stroke. So this is also under the large vessel complications. And again, the main concept here is your body is not designed to tolerate very high levels of glucose within the blood for a long amount of time. And so when it's accumulating, over weeks, months, years, then it can lead to so many different problems, right? That patients will often need to be managed for a very, very long time. Okay, moving on. So this is an important question that many patients often ask. Can diabetes be cured, right? So what we can say is this. There is no cure as of now. However, it can be controlled with medicine, food, and lifestyle, right? So that's why we often refer to diabetes treatment as management as opposed to a cure. You know, when you have something like say TB, right? Tuberculosis, or you have a cough, or you have a stomach upset, right? We can give you medications and then you heal completely such that you never have the symptoms again. That is not very straightforward with diabetes, or rather, it's not the same case, such that we tend to just need to manage the symptoms and make sure that your blood glucose is at a reasonable level or within the reference ranges, right? And so people with diabetes can successfully live a very healthy and long life. For type 1, this is the one we said is most common in children. It's the one that is caused by insulin not being produced. And this one is usually managed with insulin therapy. Then for type 2, it's usually managed with other medications such as metformin, as well as insulin therapy in certain cases. So as we can see, you need to monitor the blood glucose level, using a glucometer. We have diabetes medication or insulin therapy. Regular physical activity can really help, as well as patients who are on a healthy diet. So some might ask, maybe a friend, family member, relative, someone who was, diagnosed with diabetes, then they changed their lifestyle, they started going to the gym, they started eating healthy, and then they were told that it has disappeared, right? So what's the explanation with that, Does it mean that there's a cure for diabetes through exercise and diet? So I'm going to answer this question in this way. Remember when we looked at the risk factors, right? So if you have someone who their main risk factor was obesity, they were overweight, and they're able to lose quite a lot of weight, right? You'll notice that the main risk factor, at least in their case, has been eliminated. So their symptoms could subside, right? However, the reason why many doctors will not be quick to say that this is the cure is because it doesn't work for everyone. You can find some patients who, they were obese, they lost weight, but they still have to take medications. Their blood glucose is still not yet at a level where it's well managed. So what we can say is you have a lot of lifestyle modifications that can drastically improve symptoms, so much so that you might not need medication at some point. However, again, this needs to be done by close monitoring with your doctor. It's not up to you to decide that, now that I've lost 10 kgs, I must be okay. No. Keep going for the clinics, keep going for the checkups, keep exercising, eat healthy, do what you can. If there reaches a point whereby you do not need to be on as much medication, or you don't need to be on medication at all, believe me, your doctor will know and they will be able to discontinue their medications. But let it not be you on your own volition, telling yourself that since I've lost weight, I'm okay, right? That's really important for us to take note of. So as we can see, we have different ways of managing the condition, and there are very many support groups that can also help you to journey with maybe other people who are experiencing the symptoms and thereby being able to get adequate support. So I'm going to end this part of the presentation with some prevention tips that are really helpful for us to all take note of and implement. So first of all, maintaining a healthy weight. So aim for a BMI within the normal range. So that's about 18.5 to 24.9. And even a 5 to 7% weight loss can significantly reduce one's diabetes risk, right? That is if you are overweight. So eating a balanced diet, focus on whole grains, lean proteins, vegetables, fruits. Let's try and limit the sugary foods, the processed snacks, and refined carbohydrates. Staying active, so engage in at least 150 minutes of moderate aerobic activity per week. So for example, the brisk walking, swimming, cycling. You need to monitor your blood sugar regularly. This is very important, especially if you are pre-diabetic or you have certain risk factors, right? So early detection helps with timely intervention. So if, for example, you are in a situation whereby maybe your father, mother, siblings, close relatives have been diagnosed with diabetes, you might need to be a bit more keen on the screening, right? Just keep going for checkups every now and then, at least annually or twice a year, to make sure, that if there is any signs of the development of type 2 diabetes, we're able to catch it early. Next, avoiding tobacco use. Smoking increases insulin resistance, and this increases the risk of type 2 diabetes. Limiting alcohol intake, so excess alcohol can also lead to weight gain and affect blood sugar control. So we need to follow safe drinking guidelines. And finally, management of stress. So chronic stress can influence blood glucose levels. So consider mindfulness, adequate sleep, and relaxation techniques. So these are just some general principles that can be very helpful when it comes to the prevention of diabetes. That is the end of the first part of the presentation. Thank you for your active participation. You can type your questions if you have any in the chat box, and I'll be able to address them at the very end of the session. So yes, do we have any questions?
Yes. Doctor, we have one. We have one. Dr. Ruby.
Yes, tell me.
So for example, let's say saying, I do not love water most of the times. Does it mean I can also be able to get diabetes? Should I
Okay.
love taking water?
Okay. Now, I would say it depends, right? How much water do they drink maybe in a day, like in terms of liters or mLs, or how many glasses of water do they take in a day? Yeah.
So I only take in the morning, during lunchtime and evening, not much.
Okay. And then
Maybe just
1 cup a day?
1 cup, and when it's raining, I do not take any.
Okay, sawa. This is a nice question. Now, let me explain it in terms of the fact that sometimes we assume that the only water that you're taking is free water, which is what you are describing, is the one, like it's plain water, you pour it in a glass and you drink. But I need you to remember that when you take tea in the morning, right? When you're eating maybe lunch and it has soup, there's some water there, When you're having maybe something like fruits, watermelon, there's water there, right? So the fact that maybe you're not drinking a lot of free water does not mean that you're not taking in water at all, right? Because basically everything else that you're eating and drinking has some level of water intake. But I think now what you can potentially consider is, can we improve, maybe the access to other sources of water? For example, do you prefer watermelon? That's an option, because at least it's a fruit, it's nice and sweet, it has a good flavor, right? And it can help to, increase your water intake, thinking about things like soups and tea and broths, that could help. Perhaps if the taste of free water itself is what is a bit distasteful for you, then you can consider other forms that can be a bit more palatable. But also with the free water, maybe a good place to start is maybe just take, a glass of water in the morning, maybe have a routine to take at least a glass or two before meals. That could also help to manage if you get cravings. Many people don't realize that at times you can think that you're hungry, but you're actually thirsty, right? So especially if maybe you're trying to improve your eating habits, right? And you find that you get cravings a lot, try and experiment with, taking some water when you feel hungry and see if, oh, actually, I was thirsty and not necessarily hungry. And also maybe trying to add some flavors to your water that might help. Some people add lemon, but let me give a disclaimer on that. It could be a bit harsh on your teeth. So often it's recommended that if you're going to be drinking or sipping on lemon water through the day, preferably use a straw, right? To just try and reduce its contact with your teeth, right? That will help to ensure that you don't get tooth sensitivity as a result of taking a lot of acidic water, right? But overall, it's a good habit to take water. Sometimes I know some people just don't like the taste of free water, but you can think around watermelon, you can think around juices, you can think of other ways to try and increase your water intake that will be more enjoyable for you. Yeah. I hope that answers your question. Do we have any other question or follow-up? Yeah.
So I have question 2.
Yeah.
So when I eat, I feel very satisfied. But again, you feel you want to take water. Is it possible for you to do that?
Sorry, could you recap that for me? When you eat,
Yes. Or she's doing it again. I'm saying there are 2 of them. So, okay, we can go. Lensa finish up because they were asking the 2 of them. So I'm waiting for Lensa
to finish.
Clarice to. Yes.
Okay, got it.
So because we are having a trouble, she's asking a question, but I can't see her hands. There is a challenge in her network.
Oh, I see. Okay.
Yes, yeah. Oh, so she's trying to ask if it's okay. You can be able to drink like you can recommend someone to drink the water at night. Maybe during the day they don't feel interested to take the water, but they only want to take the water at night. Is that okay?
That's okay. That's absolutely fine. Only thing is, of course, they might find themselves waking up to go to the washroom. But it's okay. It's okay. Yeah. Only that they might, be waking up a lot to go to the washroom. Yeah.
You're welcome. Thank you, doctor. She's telling you thank you.
Okay. Great. Any other questions?
But she's asking about the balanced diet.
Mhm.
Maybe for example, So maybe you're eating ugali, and
Mhm.
the other parts of things, maybe ugali, maybe you continue, maybe you have eaten ugali, but you want to eat something else.
Mhm.
Is that okay? Like, for example, you have eaten ugali, but you have missed all the other nutrients. What will happen to
Mhm.
that?
Okay. Now the question would be, is it maybe on just one day that perhaps you've just eaten ugali, but not the rest? But generally, maybe in a week or on average, you do have a balanced diet, right? So it's less about maybe on one particular day and more on what is your habit over time, right? So of course, sometimes you can get busy. Sometimes, you're in a place where maybe for like a few days, you're needing to eat chips alone for lunch, but is it your routine, In fact, maybe a better measure would be, say, in a month, right? How often are you eating a balanced diet? And if, on at least most of the days, say 80% of the days, you are at a good place and taking in a balanced diet, then you're probably going to be doing pretty well. Now, also, something to take note of, for adults and children, our dietary needs are different. You see, with an adult, you can even fast for a month and okay, you'll be a bit hungry, you lose weight, but you'll mostly be fine. Now, with a child, you need to be a lot more keen on them consuming a balanced diet, because they're actively growing. So that's something else for you to think about. Or say if it's a pregnant woman, very different, right? Because she is not only catering to her own needs, but for the baby as well. But if you're just, a normal adult, you don't have any particular illness, you're not expectant, really, there's a bit of leeway. I think a general rule, although don't quote me on this, but at least try, say 80% of the time, you're having a balanced diet. The other 20%, you have some room. You have some room. Yeah.
Thank you, Daktari.
You're welcome.
And so we have a question from Samuel.
Yes, yes.
Dr. Ruby. So
Yeah.
thank you for the advice about the how we can be taking about the diabetes. So so me, I want to talk about something else, maybe about the three types you've told us. So I want to ask about something. How can you be able to manage, and how maybe if you have that, if you've gotten a sugar, how can you be able to block it, or how can you be able to refrain from taking sugar? Is it from the normal sugar, or which one? Which sugar is it exactly?
Okay. This is for someone who already has diabetes or someone who's trying to prevent. Maybe just want to clarify on that.
For someone who has diabetes.
Okay. So if it's for someone who is diabetic, the first thing I'll say is you need to be followed up by your doctor, right? Now, I'm not going to give a clear yes or no as to what you can or cannot eat because it will depend on what are your current symptoms, how well is it being managed, what type of medication that you're being given, right? So certain patients have very strict guidelines. Others maybe have a bit of wiggle room, right? It all depends on how you are responding to the treatment and it depends on what stage of treatment that you're at, So what I would say is the best person to be able to guide accurately on what exactly you can or cannot eat is the doctor who is following up with you or the facility where you are getting a follow-up. And it's also really important for diabetic patients to ideally go to one place for follow-up. Don't say maybe, you know, this month I'm going to, I don't know, Mater Hospital, and then now later on you go somewhere else. It's like you will get the best results when you're having consistent follow-up with a licensed medic who is able to know your case, understand your case, and if possible, even a specialist, right? That really helps just for that continuity. Truly, as long as you're going to a good hospital, accredited hospital, can be public, can be private, they will know how to manage you very well, right? Just that you need to be consistent in who you're seeing and how they're following up with your case, so that, you know, in case something happens, you know, they have your file and they have your records and they will be able to inform. Maybe to even give like an example, you know, if you have a patient who maybe has been very well managed for a long time, they're on medications and they're doing well, for them, they might be told, okay, say taking cake once in a month is fine, you know. But for someone else who, you know, they have the retinopathy, in fact, they've not been compliant with their medications, maybe they're a bit elderly, you see, their guidelines will be very different. So that's why it is really important to, you know, go to a licensed medic, you know, somewhere that you can be followed up consistently, and they'll be able to now walk that journey with you, even in terms of your diet, lifestyle, what you can and cannot eat at every point in the journey of management and treatment. Yeah.
Okay, that's okay, doctor. There's another one I want to do a follow-up. So we have maybe some people who say, maybe I have diabetes. And then they always say, you see, the behavior of saying, if you keep on taking sugar, the sugar that we take in the tea, if you keep on taking the sugar, you will get diabetes. Is that the case?
That's a
Hey, wow,
good
thank you for
question.
asking. I wanted to ask that also.
That's a very good question. Now I'm going to take us back to what we discussed on risk factors. In fact, if possible, let me be a typical teacher here, right? Tell me what you understand by risk factor when we discussed it in the presentation. What do you understand by what we explained on risk factors? Yeah. Do you remember? Yeah.
So there's just some few things I remember, maybe about obesity,
Yes.
about maybe someone who is not being able to practice, and yeah, maybe those are what I can remember.
Okay, great. No worries, you're on the right track. So let us build on that, okay? Now, when we talk about risk factors, right, just to remind ourselves, it means that you will have a higher chance of developing a certain disease if those risk factors exist. However, it is not a guarantee, right? So looking at something like taking a lot of sugar in your tea, right? It does increase your risk of developing diabetes, but it is not a guarantee. Remember, many times risk factors need to exist in community with other risk factors. For example, right? If I am taking 5 spoons of sugar in my tea and I have a family history of diabetes, my mother is diabetic, my father is diabetic, I have 3 aunties and 2 uncles, then there's someone else who is also taking 5 spoons of sugar in their tea, but for them, none in their family has diabetes. You would find that even though we are both taking the same amount of sugar and it's a lot of sugar, I am at a higher chance because I have 2 risk factors and not one. You understand? Because I'm taking a lot of sugar, but also I have family history, right? So the way in which the risk factors will combine and either cause the disease or not cause the disease, truth be told, that is up to God, right? We really cannot determine with certainty that this person, because they're taking 5 spoons of sugar, within 1 month, their blood glucose will be high. We really can't tell. However, we can encourage good practices as a way of precaution, right? So that's why sometimes when you hear statements around, don't take so much sugar because you'll get diabetes, it's not so much, we are saying it with certainty, but we are saying that if other factors combine in your case and maybe you're a bit unlucky, then this could be increasing your risk of getting diabetes. So I think a safer word to be using is risk, right? So what is increasing your risk? What is reducing your risk? Yes. Does that make sense?
Yes, that's okay, Daktari.
Fantastic. I see we're at the top of the hour, but maybe if there's any other last burning question, I would be happy to address it. Thank you so much for all your questions. This has been so fun for me.
So about the stress management, Daktari, that you've said.
Yes.
I'm just worried. I'm just wondering how is it like how can you be able to manage the stress, because with this current situation, like you see,
That's a great question. And what I can say is exercise helps. Actually, exercise can hit very many birds with one stone because it helps to relieve stress, It will also help you to maintain a good, healthy weight, right? And it will also just provide a good outlet for you even when you're feeling a bit overwhelmed, and you're able to release what we call feel-good hormones, right? If you've ever heard of, certain hormones that your body produces when you're exercising will actually help to relieve stress, because you'll be able to sleep better, you'll be able to feel more energetic, and you're also able to, maintain a healthy weight. So when it comes to stress, I always feel as though exercise is a great way to go about it, right? Because it helps you to hit many, many birds with one stone. Yeah, that's what I'd say. I think someone
I've seen this one. Yes, someone had raised their hand. Yes, Corinne.
Yes. Sorry. So I don't know, if someone has asked the question, but let me just maybe repeat because I wasn't hearing quite well. It's about the sugar in fruits. So like some doctors, they normally say that the sugar in fruits isn't as good as we tend to believe. So maybe like, what's your view on that? Like, should we like take the fruits? Because at times we avoid because we feel that the sugar in the fruits might also contribute in diabetes. Yeah. So like, what's your view on that? And also honey.
Honey as well. Nice.
Yeah.
It's a good question. Thank you. So this is what I can say about the sugar in fruits. First of all, it depends on, is this a patient who is already diabetic, or is this someone who is trying to, prevent themselves from getting diabetes? Now, the next thing I'm going to say is sugar in and of itself is not a bad thing because we need it for energy, right? The real question is, what is the quality of sugar and what is the quantity of sugar, right? Now, if we break it down in that way, I think things will get a bit clearer, because when it comes to the quality of sugar, we've already determined that we need it for energy, for survival. We need sugar. So what are some good quality sources of sugar that will, be a bit less problematic to your body's metabolism? Fruits are, everyone would agree, a high quality source of sugar, right? On the other hand, you can have refined sugars, like what you find in soda, what you find in, like the sugar that we put in our tea, which is not as good in terms of the quality of the sugar, right? And how your body interacts with it. Now, the next thing that we need to look at is quantity. So how much sugar? Because truth be told, right, I can be taking good quality of sugar, but I'm still taking so much of it that I'm still operating at an excess. You understand? Or I could be taking, some lower qualities of sugar, maybe like soda, but I'm taking very little of it. Maybe like what? once in a week or less, right? So when you balance these out, then it creates an environment where we can make more informed decisions. As a general rule, you want to balance both quality of sugar and quantity of sugar. Ideally, you want to take the higher quality sugars more, so like what is present in fruits and vegetables, and you want to take less of the refined sugars. But even with the healthier versions of, sugars like in fruits, etc., we also, do not recommend that you're just taking fruits morning till evening, every day for months. You need proteins, you need fiber, you need roughage. So you're also balancing it out, right? It's not a matter of like completely eliminating it. It's actually an aspect of balance, right? So trying to make sure that I am taking good quality sugars. I'm also taking them in a decent quantity, right? And I'm also, adding other parts of my diet, that I'm having enough protein, I'm having enough fiber, roughage, I'm having enough, carbohydrates, so that everything balances out well. But when it is well managed, right, that you're taking good quality sugars in good quantities, then you are reducing your risk of getting diabetes. And again, you see that I keep using the word risk because that's the correct word to use, because I can't tell you with certainty that, if you take 5 fruits for 5 days, then, you will, it doesn't really work like that, It is a matter of we're trying to reduce risk. And so we are trying to maintain good practices that are putting us in a better position to not attain some of these lifestyle diseases. Yeah. Does that answer your question, Corinne?
Yes, it does. Thank you.
All right, you're welcome. Oh, I see we are way past time. However, this has been so much fun. Maybe allow me to hand it back to our moderator to close off our session. And yes, we can conclude. Yeah. Doreen, if you're here, you can wrap it up for us.
Yeah, thank you, Doc. Yeah, this was a robust presentation, and thank you.